Question: A 45-year-old male presents with recurrent episodes of severe, throbbing headache, often localized to one side of the head. These episodes are associated with nausea, vomiting, photophobia, and phonophobia. He reports that during the headache, he prefers to lie in a dark and quiet room. These headaches have been occurring for several years and typically last for a few hours to a day. Neurological examination between episodes is normal. Which of the following is the most likely diagnosis? A. Migraine with aura. B. Tension-type headache. C. Cluster headache. D. Sinusitis headache. The most likely diagnosis for this patient is C. Cluster headache. This patient's clinical presentation is highly suggestive of cluster headaches. Here's the rationale for choosing this diagnosis. Recurrent severe headache. The patient experiences recurrent episodes of severe, throbbing headache. Cluster headaches are known for their excruciating, one-sided, and stabbing or piercing quality. Associated symptoms. The headaches are associated with several characteristic features, including nausea, vomiting, photophobia, sensitivity to light, and phonophobia, sensitivity to sound. These symptoms often accompany cluster headaches. Duration and frequency. Cluster headaches typically occur in clusters or bouts, with multiple headaches per day during a cluster period. Each headache episode is relatively short, lasting from minutes to a few hours. This pattern matches the patient's description of recurrent episodes lasting a few hours to a day. Preference for dark and quiet room. Patients with cluster headaches often find relief in lying down in a dark and quiet room during an attack. This behavior is consistent with the patient's report. Normal neurological examination between episodes. The patient's normal neurological examination findings between headache episodes are typical of cluster headaches. Unlike migraines or other conditions, cluster headaches do not typically cause persistent neurological deficits. Now, let's consider the other options. Migraine with aura. Option A. While migraines can share some features with cluster headaches, such as severe pain and sensitivity to light and sound, the clinical characteristics described here, including the short duration and frequent occurrence, are more suggestive of cluster headaches. Tension-type headache. Option B. Tension-type headaches are usually described as a constant, dull, non-pulsating pain. They are not typically associated with severe throbbing pain or the other symptoms mentioned in the case. Sinusitis headache. Option D. Sinusitis headaches are often associated with sinus congestion and tenderness on examination. This patient does not report sinus-related symptoms or show signs of sinusitis on examination. In summary, given the patient's clinical presentation, including the severe, one-sided, recurrent headache episodes with associated symptoms, the most likely diagnosis is cluster headache. Cluster headaches are a type of primary headache disorder characterized by their distinctive features and are considered one of the most painful types of headaches.